Welcome. My name is Dawn Milton, and I am the Privacy and Compliance Officer for the department. I'm really here today to talk to you both, obviously, about privacy and compliance, but regardless of what job role you're in, you are going to be working with sensitive client information. Whether you're providing direct services, whether you are a clerical staff that might be working at the front desk, whether you're IT, whether you're management, whether you are working in finance. Every single one of us is going to be either face-to-face or on paper working with sensitive client information that we all need you to be aware about. And so really, when we talk about client privacy, our clients are very vulnerable with us. They're sharing really private, sensitive information about trauma, about different things that are going on with them. And so really, it is part of great customer service to make sure that we are ensuring the privacy of their information. They want to feel comfortable sharing information with us and knowing that we're not going to disclose that information to somebody who's not supposed to have it. So we'll go ahead and get started. And again, if you have any questions, please feel free to stop me and we will make sure that you get your questions answered. And then my contact information will be at the end of the presentation. So if you have any questions that come up afterwards, please feel free to call me, email me. We also have a hotline that you can leave a confidential message on, or you can just leave me a question and I'll call you back. So let's get started here. So during this presentation, you're going to be introduced to really the basics of confidentiality, as well as provided information on our corporate compliance program. So as a new employee, you don't want to act independently in any of these situations until you are very familiar with how you're supposed to be protecting information, how you're supposed to be disclosing information. I just really want to stress that as a new employee, you want to make sure that you're consulting with your supervisor before you're really doing anything that you're unfamiliar with. So we do have several related policies that we'll reference throughout the presentation. All of our policies are available on our mental health intranet website, which we call the MHNet. And during your orientation with your team supervisor, they will be providing you with instruction on how to access MHNet, which includes a ton of information, but also includes our policy and procedure manual. So any policy that we're talking about here today, you'll be able to go back to your desk and reference the entire policy. So you're going to hear the term PHI quite frequently throughout your employment with the department. And as Steve mentioned, that is protected health information. Okay, so PHI is any information pertaining to an individual's past, present, or future mental health condition or treatment, physical or mental health condition or treatment. So this includes any information that's going to identify a client as a recipient of services. It could be their name, their initials, their date of birth, their social, their address, any number of items that will just identify them as a consumer of services. And then we do have an expanded definition of protected health information in policy 10.1.17. So HIPAA. HIPAA is the Health Insurance Portability and Accountability Act, which was passed by Congress in 1996. And it was to establish national privacy protection standards for all forms of health information created by healthcare providers, and provides for the physical and electronic security of personal health information. And it gives clients a lot more rights than they used to have over their health information. So HIPAA increased a client's rights in a variety of ways. It increased the requirement for an authorization so that their information is not disclosed to someone that they don't want it disclosed to. It increased the client's ability to see who received their protected health information without an authorization. They are able to request an accounting of disclosures, which will let them know. It's a document that we have to complete if we release their information without their authorization. And so they have the ability to request who has authorized or who has received their information over the last 3 years. So that's one of the additional rights that they have. And it does make it easier for a client to get a copy of or review their own medical record. So we have a couple different policies that do relate to this, and we have a form that the client can complete to request copies of their health information. Your team supervisor will complete a form and send that to the director, and then we'll be able to provide copies to the client of their own health records. Now, in keeping this in mind, as you're learning about documentation, especially for clinical staff, just know that anything that you document in the record, the client does have the ability to get a copy of and read. So you want to make sure that you're only documenting clinical information. You're not documenting your opinions about them or their significant other or their family member, because this is all information that they'll have access to if they request their records. So minimum necessary. This is a concept in HIPAA that ensures that PHI is being limited in its use and disclosure and minimizes the risk to the security of data. So access to PHI must be the smallest amount necessary in order for you to do your job. So if you are a support staff, you don't need to have all of the information about the client's past mental health history, about the medications they're taking. The only interaction you may be doing is filing information in the record. It may be calling to schedule appointments, that kind of thing, or confirm appointments. So you should only be utilizing the information that you need to do your job and not accessing more information than what you need to do your job. For example, we do have an electronic health record, which you're going to learn all about next week, and it would be inappropriate to access an electronic health record from somebody that you're not working with. It would be inappropriate if you had a family member or a friend or an acquaintance who was receiving services from the department. You shouldn't have access to their information to take a look at that. So that would be an inappropriate access. So the primary confidentiality law for government agencies, including Kern Behavioral Health and Recovery Services, is Welfare and Institutions Code 5328. And this law states that all information and records obtained in the course of providing mental health services are confidential. So in the state of California, when we are obtaining authorization to release information, California requires a physical signature. You can't do a verbal authorization. It does require a signed document for releasing that information. And then those situations in which confidential information may be released without a consent is described in this Welfare and Institution 5328 code. Just also wanted to mention too, I'm going to be providing some handouts to you at the end of the training. So today, just pay attention, listen to what I'm saying. You're going to have a lot of time to really absorb all this information. We realize this is a lot of information to tell you right up front, and you're not going to remember all of it. But we just want to give you some basics so that you at least are aware of what HIPAA is, what confidentiality and privacy are. So another law that applies to our services here is the Code of Federal Regulations, and it is Title 42, Part 2, and commonly that is referred to as 42 CFR. You'll hear that terminology quite frequently. And this one protects persons in substance use treatment, and in cases where it is more stringent than HIPAA or even the Welfare and Institution Code, it overrules, and so we need to follow this particular law. And so this is going to have to do with clients that are either in treatment in a substance use provider team. It could be somebody who is on a mental health team, but maybe they also have a substance use diagnosis. This could be somebody who reported to you that they used marijuana or used some other type of substance, and you're documenting it in your record. Now that information is protected by 42 CFR if it has to do with substance use information. And so in this case, we do have to have a signed authorization in order for us to release any type of information relating to substance use. More in 42 CFR. So I mentioned this already, that our records that include any type of substance use information, even if you are working on a mental health service provider team, is covered under this. And there are, because of the restrictions, it does require a specific consent. On our consent for, or not our consent for treatment, our authorization form to release or exchange protected health information, we have a checkbox on that form where the client can choose to release mental health information, substance use information, or both. So if substance use information is not documented on that form, we don't have that authorization. And if we received a request for records for information that might include substance use information, we would need to go back and ensure that we have the client's authorization to do so before releasing any information. Again, consult with your supervisor. Anytime you are doing something that is unfamiliar to you, even if you think, I got this, I know what I'm doing, as a new employee, you just really want to consult with your supervisor before you're doing anything like this. Okay, so the notice of privacy practices. I imagine most of you are probably aware of what a notice of privacy practices are. If you have received services from a new medical provider at any time in the last several years, the first visit that you go and see that new doctor, they give you a form to take a look at the notice of privacy practices and have you sign an acknowledgement form that you are aware that you were given a copy. And the same happens for our clients as well. So the Notice of Privacy Practices explains to the clients how their health information and privacy rights, how their health information is going to be utilized and protected by the department. And it does give them instructions on making complaints if they believe their rights have been violated. It gives them information on how to contact the patient's rights advocate and also myself as the privacy officer. And then clients are given a copy of the Notice of Privacy Practices at the initiation of treatment. When we do their annual treatment plan and reassessment, we provide them a copy at that annual time. And then we do provide it to them at any time that they request a copy of it. And we do have posters displayed at all of our treatment sites that let folks know if they want to request a copy of that Notice of Privacy Practices, how they can do that. This is one document that I would suggest you try to familiarize yourself with, just so that you are aware of the types of rights that our clients have and how their information is going to be used and disclosed. It's a fairly brief document, I want to say maybe 7 or 8 pages, but it's something that I think is important that you at least take a look through. And this is an attachment to policy 10.1.21. So informed consent. During the course of your employment, it will be necessary for most staff to obtain informed consent from your clients. And for informed consent to be valid, the client must be legally competent and able to understand the nature and consequences, what information is going to be disclosed, for how long it's going to be disclosed. And so they should understand the information that's being shared. When you are informing the client about their treatment, it isn't handing them a piece of paper to sign, it is explaining to them what they're signing so that they understand, for it to be informed. So that signature on the document merely memorializes the conversation that should have already taken place. So obtaining consent to release. We talked about this a little bit already, but this will be fairly common practice for clinical staff to obtain authorizations from clients to release information. And there are many laws pertaining to confidentiality, and this is something that we must diligently protect. As I mentioned earlier, it's part of good customer service, but we want our clients to feel comfortable in sharing their information with us so that we can best provide treatment to them. There are examples when you will be able to release a client's information without their consent. There is a document that's attached to one of our policies, 10.1.14, that will explain the different types of situations. One particular example would be in our TerraSoft policy, and this has to do with when a client makes a serious threat of physical violence against a reasonably identifiable victim. So in cases like that, certainly you're going to consult with your supervisor. This isn't something that we do very frequently, so it's always important to consult. But this is something where we need to be able to notify a person who a threat has been made against, or to notify law enforcement that that's happened. So we do have certain instances where it is okay to release information without a signed authorization, but again, those are instances that you'll always consult with your supervisor about. Responding to requests for records. So I just wanted to touch on this. We talked about it a little bit earlier, support staff will typically be that first contact person that will receive the request. Typically that request is going to come from our closed medical records department, but it's really important to understand that even though the support staff is logging the request, may even be making the copies that's necessary for the request, a clinical staff person, a licensed staff person, or the supervisor needs to make sure and review all of that documentation. There are instances like we talked about with substance use where if we don't have a specific consent, we might need to redact some information from the documentation before we can comply with that request. So if a support staff is just going through and making copies of certain documents, we might miss that and inadvertently send information that shouldn't have gone. So it's really important that an LPHA, which we call a licensed practitioner of the healing arts, a licensed staff is reviewing that documentation and authorizing everything that will be sent. Mandated reporting. So all Kern Behavioral Health and Recovery Services employees who in their professional capacity or within the scope of their employment have knowledge, proof, or observe a child, dependent adult, or elder adult whom they know or reasonably suspect has been the victim of abuse, neglect, or human trafficking must report. There are different circumstances that apply for folks who are using substance use, who are receiving substance use services or using substances. So make sure that you do consult with your supervisor before making any type of a report. And then be sure to review the policy on that as well. There are some times where you'll be contacted with other agencies requesting information from you. It might be from public health or for law enforcement. Just know that these entities do not have a right to this information. There's going to be certain instances like we talked about with the TerraSoft reporting, but that just because they call you asking for information doesn't mean you automatically need to provide that information to them. Always consult with your supervisor to determine whether or not you can respond to that request. HIV documentation. We have several clients, a good population of folks who have both medical and they have mental health or substance use disorders, and you're going to come across clients who do have HIV or AIDS. I would say a lot of them are very forthright. They'll tell you all that you want to know about it. They don't mind that this information is in their chart, but as a department, as somebody who's trying to protect their privacy, we want to make sure that we are not documenting anything about HIV or AIDS in the record. And the reason we do this is because it's just too easy to inadvertently disclose that information if we're processing a records request. And we don't want to accidentally give away that type of privacy information. And so if you are working with a client and the session happens to revolve around maybe how they are dealing with that HIV or AIDS, you want to make sure that you document that as a medical condition and not specifically as HIV or AIDS. We do have a way that our doctors and nurses can document this in the record, but it's a complete separate tab that not everybody has access to. So we just want to, for the purposes of documentation, make sure that we're not documenting that in a treatment plan, in a psych eval, in a progress note, in an assessment. You do want to just indicate that it is a medical condition. Securing physical PHI. So when you leave your office, whether that's to walk down the hall or whether that's to leave for lunch or leave for the day, you want to make sure that you lock your door behind you. If you have any type of PHI in your office, you have charts sitting on your desk, you want to make sure that that information is secure. If you work in a cubicle, you're going to need to make sure that any PHI that you have out on your desk that you're working with is locked up in a drawer before you walk away and leave it, okay? When meeting with clients, you want to ensure that all information, including any kind of medical records, is protected. You might be support staff who's working up at the front desk reception, and maybe you're working with a client list or even some client charts. If somebody walks up to the counter, you want to make sure that you flip that chart over that's on top or that piece of paper that's on top so that somebody walking up to the counter can't see any protected health information about a client. Don't leave a client unattended in the office. some of us will have computers that are hooked up with a network printer, and maybe they need to walk down the hall or up to the front office to retrieve something off of a printer. We just want to make sure that we're not leaving our client in the office by themselves while we're going to retrieve that. It might mean you needing to take the client up to the lobby, that kind of thing. Because if you think about it, all of us have all kinds of protected health information in our office that we're working with, and we want to make sure that that's not readily accessible to anybody who's wandering the halls. You want to make sure to retrieve faxes and printing to a common printer promptly. So our fax machines are kept in a secure location, but we want to make sure that we are checking that frequently and there's not client information that is getting left there or on a network printer. We have had a few instances where clients were inadvertently given the wrong information because somebody picked that information up from the printer, and maybe it was more than just their information. It might have been information that somebody else had just printed. And so you do need to be careful as well when you are retrieving that information, that the information you're retrieving is only the information that you sent there. Conducting confidential conversations in a private area. This is sometimes hard to do if you work in a cubicle, but most of our sites do have rooms where you can, what do I want to call it? Evaluation rooms. They have evaluation rooms that you can go and meet with your client in if you're in a cubicle. You want to be careful about not having confidential conversations up at the front desk. I know that that happens from time to time. We want to make sure that there's no way that somebody else is going to overhear that information. And also when you think about those types of conversations, you want to keep in mind that minimum necessary that we talked about. You need to know that information in order to access that information. So your support staff who's up at the front doesn't need to know about the case consultation that you're having. So make sure that you are having those conversations in a private location. When calling a client, you want to make sure and not leave any messages containing PHI on an answering machine, on a voicemail, because you don't know who might be retrieving that information. Oftentimes we have clients that maybe their family member, their significant other may not know that they're getting services, and certainly that wouldn't be the way that we would want them to find out. When you are leaving a message with a person or someone other than the client or their legal representative, their legal guardian, you want to make sure that you are not identifying yourself as, I'm calling from Kern Behavioral Health. You might want to say, I'm calling to confirm a doctor's appointment with Dr. Smith, and not necessarily indicate that you're calling from the mental health or the substance use team. There are going to be times when you need to take PHI out of the office. You might have a client roster that you're working with. You might need to transport a chart for some reason. When you are transporting protected health information, it needs to be in a locked briefcase in the trunk of your vehicle. All of our sites are equipped with locking briefcases, so make sure that you check one of those out. If you have a vehicle that does not have a trunk, you want to make sure that it's in the rear of the vehicle. A lot of the SUVs have those secret compartments. Stick your lockbox in there, or make sure that it's in the back to where it is not visible to someone else. But you also want to make sure that that PHI is not left unattended in a vehicle at any time. And that is not only our own internal policy, but that is one of the regulations by the Department of Healthcare Services, which is our contract provider, we're contracted with to provide these services, and they're the ones who we submit bills to. And so we want to make sure that we're following all of our contract requirements. At the end of your workday, perform an inspection of your workstation and just make sure that you have not left anything out. Make sure that any PHI is in a locked drawer or in a filing cabinet that's locked. We did have an instance probably about a year ago. We had a staff member who left office unexpectedly, quickly at the end of the day, forgot to lock up that information, and that particular site happened to get broken into overnight. I think a teenager threw a brick through the window, and so all of that information was out. Anytime we have a breach like that, there is a report that is required to be submitted to the state of a breach notification. And so when that happens and they determine that yes, in fact, a breach has occurred, we have to provide letter notification to each of the beneficiaries that their protected health information was breached. So you don't want to find yourself in that situation, so please just make sure that you do an inspection of your workstation, make sure that everything's locked up at the end of the day. And then we do have more information in the policy about this as well. So securing electronic PHI. There's only 2 places you should store files containing protected health information, and that's going to be on your H drive or on your T drive. Your H drive is going to be the file that is set up by IT that is secure, that you can store all of your own documents in. A T drive is something that we use on our teams. So it might be that documents that all of the team is going to be utilized can be saved on that particular drive, and your supervisor will talk to you more about that. You want to never store files containing PHI on personally owned devices, on your desktop, your My Computer folder, and certainly not on cell phones or tablets. PHI may only be stored on your local C drive if it's encrypted, and we'll talk about encryption just a little bit. When transporting a laptop, and a laptop as an electronic device has to be encrypted if we have PHI on it. But if you're in a job position where you're using a laptop out in the field, you want to make sure that you're transporting that in the trunk of your vehicle. Password security. So you're going to be assigned a user ID and a temporary password when you log into the system for the first time. And then you'll be required to change that password once you log in the first time. And you want to know that anything done with your password is your responsibility. You want to never share your computer accounts or your passwords. Don't leave your workstation without logging out. Whether you work in an office or whether you work in a cubicle, our policy states you're going to lock your computer screen when you walk away. So that's hitting the Control-Alt-Delete function on your computer. Don't post your passwords on your monitor. Don't put it on a sticky note under your keyboard or right inside, your top drawer. You want to make sure that if you do write your password down somewhere, that you do keep it in a secure, locked location and not anywhere obvious that people can look. And then, of course, more information. We do have a policy on computer usage. So PHI and email. So this does pose a risk when you are sending information. You want to limit the information transmitted to that necessary to meet the recipient's needs. And you want to use caution when you reply to an email. Our internal policy with email is that PHI cannot be sent in email unless it's in an encrypted attachment. Other departments within the county don't have as strict of a rule as we do regarding that. The type of sensitive information that we use, it's just too easy to inadvertently send it to the wrong place. We have staff in our department or even in the county where there's more than one staff with the same name. And so occasionally you may receive an email that was intended for another John Smith. And we've had that happen. And we've had that happen with protected health information. So if you receive email from another department and it contains protected health information, you want to make sure you remove that PHI before you respond to the email or before you forward it on to someone else. I would have to say that that is probably the single most reason that our staff inadvertently send PHI an email is when they're responding to an email and they didn't realize or they didn't remove that PHI before they responded or forwarded it on. You want to ensure that the body of the email includes a confidentiality notice, and we'll give you some more information about how to do that. So you want to assign a password to a document using the secure zip encryption tool. And the file encryption quick guide can be found on MHNet, and I've provided information in the handouts that I'll provide you as well. You want to make sure that you don't include the password in the body of the email. And don't use an obvious password such as the word password or your name. Don't include PHI in the title of the document. Even though you are encrypting the document, when you are sending that email to someone, the name of the document will still show up. You'll have to click on it, enter a password to open it, but I don't know how many times I've received an email from someone when they thought they were encrypting it, and the title of the document might be the client's name or the client's chart number. So you just have to be careful making sure that the title of the document does not include PHI as well. Certainly report any misdirected emails immediately to your supervisor, and do not use email to communicate with a client. Not only does that risk their privacy, at times there is an expectation that somebody is going to read that email and respond to it. It's been probably a couple years ago since I was aware of an incident, but we had a client who was emailing their treatment provider, their therapist, their recovery specialist, kind of as a way of venting, getting things off their chest. But there was a particular email where this client reported about being suicidal. And we want to make sure that our clients don't have an expectation that someone's going to immediately see that email in the morning and respond to it. That staff may be out of the office for the day, they may be on vacation, and that information is sitting with someone who can't help the client. So when we're explaining to a client, if they do contact us by email, we want to explain to them that we really don't want to communicate with them in that way because it really is to protect their privacy. And then, of course, we have more policy information on that as well. So faxing. We're going to be faxing PHI quite frequently throughout the department. And you want to make sure that you are calling that intended recipient first. You want to make sure that someone's there to receive the fax that you're getting ready to send to them, and also to confirm that fax number. You want to make sure when you need to dial 9 from your fax machine. So all of our fax machines should be labeled on whether you need to dial 9 or not. But the way that our system works, all of us have a 5-digit extension. When you call someone, you just have to dial that 5-digit extension. You don't need to dial the full 7 numbers. So what happens is if you were supposed to dial 9 with that fax machine and you forgot to, it's going to pick up only those first 5 digits, and that's where the fax is going to go to. So you just need to be very careful. We do have one treatment site whose fax number, the first 5 digits of their fax number, happens to be one of our Board of Supervisors. And we've had a couple instances where PHI inadvertently got faxed there. So you want to just be very cautious when you're faxing, know whether you need to dial 9 or not. And then you want to ask the recipient to call you back confirming that they received the fax. If they do not call you back, you need to call them and confirm that they received the fax. And then report misdirected faxes again to your supervisor. Cell phones and text messaging. So we want to never ever use text messaging to communicate PHI. Text messages are not secure, and you would violate a client's privacy by doing that. They are not encrypted. So ensure that you don't use text messages to communicate with a client, with a staff member. A lot of us end up using our smartphones to communicate with our supervisor while we're out in the field. It's okay to do that, but you just need to ensure that none of the information that you're discussing or texting is client information. Social media. So this one, PHI or other confidential information should never be shared on a social media site. Although you think that information may have been de-identified, it may be possible to identify an individual even with minimal information. Facebook, Twitter, and Instagram and other forms of social media are considered public domain, and anything you post there is considered public information. And understanding that even a deleted post still exists in cyberspace. Knowing that even if you posted something and then you realized that was a mistake and you deleted, somebody could have made a screenshot of it. So you want to be very cautious about anything that you post on social media. Your Facebook profile may identify your place of work and your occupation. When linked with your posting and any other publicly available information, these additional details may identify a client. So I want to go into social media don'ts. So don't post anything on social media that you wouldn't say in public. If you wouldn't say it in an elevator with somebody else behind you listening, you shouldn't post it on social media. If there's a doubt about a certain post or a picture, give me a call, discuss it with your coworkers, with your supervisor. Make sure that you consult before posting something that you might regret posting. Don't friend a client on Facebook, and don't reply to a client's post. This could inadvertently identify your relationship with the client, and certainly it blurs the professional boundaries. And please don't take a selfie at your workstation. We've had this happen before. You know, somebody thinks they're taking an innocent picture, you know, look what I'm doing today, or I'm busy at work, and there's information that's behind them in the background that they don't realize, and they've inadvertently disclosed PHI over Facebook, over whatever social media site that they're utilizing. So not a good idea to take pictures of your workstation, selfies, that kind of thing at work. In addition to confidentiality issues, public employees do occupy a trusted position in the community and should carefully consider the implications of their speech and any other form of expression when using the internet. Employees should not post material that may negatively affect the confidentiality, safety, or professional reputation of employees, families, or clients served by the department. Employees should not post information or opinions that may create a negative impact on the credibility of either their own professional role or that of their coworkers. This is never the time to vent about what happened at work today, or that your coworker that you're so upset with. It really does paint the department in a negative light, and we want to avoid doing that. At the time of hire and annually thereafter, each employee signs an acknowledgement of universal expectations, which I am sure most of you received during your onboarding on day one. So if you haven't read through that, make sure that you do take a look at it. Some of this information about social media is on there. There's also some information in there about confidentiality as well. So access to health records. So again, at the time of hire and annually thereafter, every employee signs an oath of confidentiality and universal expectations, agreeing not to look at their own records or those of family members, and not to access any records outside of their assigned caseload unless it pertains to the scope of their regular business activities or supervisor approval has been obtained. So we have a process that's called sequestering medical records. So a chart should be sequestered for any client who is also an employee of the department. You may be somebody who has received services from the department in the past, and now you're coming on as an employee. You should in no way have access to your own medical record, and so you should request that it be sequestered from you. If you have a family member that is receiving services, or anybody that you really know on a personal level, we should make sure that that chart is sequestered from you. When you go through Cerner training next week, they'll talk about this a little bit more, and they'll give you the opportunity to fill out the sequestered chart form. If you know of or you suspect that anybody that you know of is receiving services from the department or has received services in the past, we will make sure and sequester that chart from you to avoid any type of temptation to take a look at that information. We do assign role-based access in our electronic health record, so in most cases you're only going to have access to just the clients that you are working with on your particular team. But we do have some teams that work more globally within the department and are making referrals to numerous different teams that might have a more open access. It might be somebody that you have access to because the client that you know is a client on your team. So that represents some pretty special circumstances, and you want to make sure that you discuss that with your supervisors so that we are ensuring that that client's information is protected. Clients who have been featured in the news in the past 6 months or who are well known in the community, we want to make sure that their charts are sequestered as well. There are, from time to time, you're going to see a news article and you're going to see the name and realize that client's receiving services on my team. And so you want to call and make sure that that chart is sequestered. Sometimes there are very high profile cases that are discussed in the media, and if that person is receiving services from our department, we need to make sure to sequester their chart. And the reason for that, again, we have, to decrease that temptation of somebody, a looky-loo, going in and wanting to take a look and see, I wonder if this person is receiving services. So we have the ability to sequester a medical record from an individual staff, or we have the ability to only allow access to individual staff. So just make sure and discuss that with your supervisor if something like that comes up so that we can properly secure the record. Oops, too far. Okay, so we run audit reports regularly to see what records our staff have accessed. When a chart is sequestered, I will receive a copy of the sequestered request as well as an audit report, which will show who has accessed that particular client's chart in a given period. Typically we go back about 6 months. And so if you have accessed that record inappropriately, we will see that in an audit report. An audit report will show us what search criteria you utilized. It will show whether you viewed a particular document or whether you printed a particular document. So just know that we are able to take a look at that information. So ensure that you're only accessing those records that are assigned to you, that you have a need to know that information. There's going to be times, maybe you're the intake person on your particular team, the person who enters all of the new client information, and you open up this record and then you realize, I know that person. Immediately close out of that, talk to your supervisor and get the chart sequestered. You're going to show up on an audit report, but just because you're on an audit report does not imply guilt. I always contact the staff, the supervisor, and try to determine was that an appropriate access or not. And most times it is one of those accidental things where you were just opening up a client's chart and realized you knew them, and so then you had the chart sequestered. Annually, each employee is required to attend a live confidentiality training, which is about a 3-hour training that myself and our Patients' Rights Office supervisor provides. And we'll go into much greater detail than what you've had here today. We'll talk specifically about the steps of the different policies. I'll talk a lot about different types of breaches that we have had happen in the department and some breach prevention strategies so that you can understand how we can help prevent instances like that happening in the future. Okay, so we're going to talk a little bit about the Kern Behavioral Health and Recovery Services Corporate Compliance Program. So the Corporate Compliance Program is a state and federal requirement, and it's designed to assist employees to adhere to all applicable rules, regulations, statutes, laws, and guidelines governing the provision of mental health and substance use services. And all employees are responsible to adhere to the corporate compliance program and all relevant policies. So compliance is used to describe a very basic concept that it is the responsibility of every organization to ensure that it complies with the law. In simple terms, compliance is primarily the detection, correction, and prevention of billing improprieties. And for healthcare, this means having a plan to ensure that claims submitted for payment are accurate and that the documentation exists for the services provided. So as you are getting additional training, if you are a clinical staff person, anytime you have a contact with a client, whether it's in person, whether it's on the phone, and that service meets medical necessity, as you'll be instructed what that is, a service gets billed for the amount of time that you provided services to that particular client. So we want to make sure that all services that we provide to our clients include accurate documentation, that you're only billing for the actual service provided, you're not billing for time in excess of what it actually took you to provide that service. So the corporate compliance program is comprised of several elements. So we've got written policies and procedures and standards of conduct. We have the designation of the compliance officer, which is myself. Effective lines of communication between the compliance officer and our employees. So I have an open door policy. If you are in the building and you need to talk about something, you want to call and make an appointment to come and talk to me, give me a phone call, send me an email. I really am here to be a resource for you. I want to be of assistance to you. And I would much rather you call me and discuss a particular PHI issue before you disclose something to ensure that you are doing that appropriately. Certainly your supervisor is going to be an excellent resource person for you as well, and we do have a lot of policies, as you've seen, that address a lot of different issues, but you may come up with a particular issue that is out of the ordinary and you're just not sure how to quite handle that. Please give me a call and I'd be happy to talk it through with you. Additionally, at least quarterly, I put out some type of a privacy or a compliance quarterly update, just to provide you with some information on maybe things that are happening in the department. Last quarter I did social media. Because we were having some issues with social media, and just to get it out there and explain to folks that this is how you do and don't with social media. So there'd just be different topics like that that I will send out periodically, and certainly I send out emails and things like that as well. If you are emailing me, just make sure there's no PHI in it, okay? Also included in the compliance program is enforcement of standards. So it will explain to you what our department uses for any kind of disciplinary actions. Provisions for internal monitoring and auditing. I believe you had a presentation from our Quality Improvement Division this morning. Our division does auditing of documentation and things like that. So we do the monitoring, auditing. Provisions for prompt responses to detected offenses and for the development of corrective action initiatives. So when information is reported to me, I immediately start investigating what it is that happened, what we need to do to correct it, if there's any type of action that needs to be taken. And there are a number of policies referenced in the corporate compliance program. You're not going to know all of these policies after coming to this brief presentation, but over time you will become more familiar with the policies and procedures. And again, these are readily accessible from your computer desktop through our mental health intranet website. And then again, when in doubt, review the policy and discuss it with your supervisor. So we have some goals for our corporate compliance program, and those are maintenance of a working environment that promotes ethical values, exemplary behavior, and compliance with the letter and the spirit of all applicable laws. The development of a program that encourages employees to demonstrate the highest ethical standards in performing their daily tasks, and adherence to the Code of Ethics. I do believe each of you received a copy of the Code of Ethics at onboarding. It was one of the policies that you initialed that you did receive a copy of. I would highly suggest that you read this entire policy. There is lots of information in there that you need to know. Another one of the goals is to develop a disclosure system, a hotline, that requires the department to respond to reports by employees or others of suspected violation of law or the principles of the corporate compliance program. So we do have a hotline, and the information is going to be provided both in your packet and at the end of this presentation. I check the hotline every single day. So sometimes staff or even community members will call and leave me a message on something that needs to be followed up on. If you would like to receive a call back, leave me your name and number. But if you want to report something anonymously, you can do that as well. And then training and communication that ensures employees understand and comply with all applicable laws, regulations, rules, and standards. So a little bit more on the Code of Ethics. It is an integral part of the corporate compliance program that really is all about doing the right thing. In addition to the ethical standards of license disciplines, employees must adhere to the basic laws outlined in the compliance program. So some of the principles that are incorporated into the Code of Ethics include confidentiality, conduct and behavior, quality of service, the rights of the client, the therapist-client relationship, business practices, and the corporate compliance program is incorporated into the Code of Ethics policy, and it's an attachment to that policy as well. So again, I would highly recommend that you do review the entire Code of Ethics policy because it does provide really valuable information for you regarding these areas. Conduct standards. So it is the expectation that all Kern Behavioral Health and Recovery Services employees will perform their duties in good faith and in a manner that they reasonably be in the best interests of the department and the public it serves. Employees must maintain a high level of integrity in their conduct and avoid any conduct that could reasonably be expected to reflect adversely upon the integrity of Kern BHRS and the services that it provides. So your responsibilities. It is required that all staff make every effort to make sure that bills are submitted accurately. We talked about this a little bit earlier. If you happen to notice something, say something. If you notice that something looks like it was documented incorrectly, or sometimes when we're entering service time, we may have meant to enter 40 minutes and instead we added an extra 0 and it put 4 hours in there. If you notice something like that, bring it to the attention of whoever created that document or to the attention of a supervisor, just to make sure that we catch that kind of information. All staff who have anything to do with documentation and billing are crucial to this process. So we mentioned earlier, regardless of what your position is, you have a role in the department and how our services are provided. And so we just need to make sure that, that we are double checking all of this information. But if you are the person who is providing that service, doesn't matter how many balances, checks that we have to do that, you are the only one who truly knows what happened during that service and what your documentation reflects. So you want to make sure that you are always acting with integrity and you are only billing for the service that was actually provided. You're only billing for the amount of time that that service was provided. So reporting privacy and compliance issues, we do have a non-retaliation policy. So no disciplinary action or other form of retaliation will be taken against anybody who in good faith reports a suspected violation. And reporting is time sensitive. I had mentioned earlier, if it's a privacy issue and we believe that a breach may have occurred, there's a privacy incident report that I need to submit to the state. And I have a certain time frame in order to get that done. So it is very important that if you suspect something, give me a call as soon as you know. You don't have to have all of the details, but just call and report to me the information that you have, and then we'll try to determine next steps from there. And we do have a couple of different policies that talk about the reporting. Reporting of privacy issues is discussed in 10.1.20, and then compliance issues are discussed in our corporate compliance policy, which is 11.1.9. Okay, so hopefully, I know it looks a little blurry on the screen there, but hopefully this form looks familiar to you. So as part of your team orientation, you'll be working with your supervisor on checking off every item on here. This is actually 3 pages long, but I'm just showing you page 1. But on here I wanted to point out that there are HIPAA and privacy security online trainings and also the corporate compliance program, and these are all trainings that are required as part of your team orientation. At the time of hire and annually thereafter, all employees are required to complete the HIPAA privacy and HIPAA security and then the corporate compliance training, and then you'll be doing that annually. And reviewing the training materials for the corporate compliance program and signing an acknowledgement form. For the HIPAA privacy and security trainings, it's an online training. At the very end of the training, a certificate will be shown. And you need to print out that certificate and then we'll send that into training services, but you want to make sure your supervisor gets a copy of that. And then for the corporate compliance program, it really is just reviewing some training materials and then signing an acknowledgement form that you are aware that you've looked at the information. These are the supplemental handouts that I'm providing to you today, and I've got a stack here, so make sure that you take one with you before you leave today. And so there is a few pages here, an overview of the information that we covered today, just highlighting some of the key areas so that you have some type of a reference that you can look back to when you get back to your desk. And then this document here is a poster that we have posted at all of our sites. Most often this is posted in the break room, but what it does is it tells you how to report privacy and compliance issues. If you lose my number, if you can't figure out where to find me, these posters are posted at every single site, and there's information on the hotline and how to get a hold of me. And it gives some information in there about what kinds of things you would think about reporting for privacy and compliance. And then also in the packet is a quick guide to our HIPAA privacy policies. So as you're probably aware, we have a lot of different policies that relate to confidentiality, some of them that we've talked about here today. So this quick guide gives you some bullet points that highlight kind of the key areas of each of those policies, just kind of as a desk guide, as a quick reference for you to take a look at. And again, if you have any questions, concerns, my contact information is here. You can give me a call, you can send me an email, you can leave information on the hotline. And again, I really am here to be a resource for you. I want to be helpful, and I appreciate and welcome your calls and your emails. I would much rather you contact me and obtain the clarification that you need before you inadvertently do something that might violate the policy. So welcome. We are glad that you're here, and if you have any questions, please feel free to let me know now, or if you think of something later, I'd be happy to speak with you at a later date as well.